Get it.
All right, my name is Curtis. I'm going to demonstrate the POTS compression test. So, if the patient has reported that they have an injury site around this part of the leg, I would start high away from the injury and start compressing down the leg like this. So, a positive test in this case would be if there's reported pain, and that pain would then indicate a chance of a fracture as the pathology. So you'd use this test to find a fracture at that part of the leg. Okay, now I'm going to demonstrate the long bone compression test. So for this one, I will say that the toe is the site of injury. So you would hold at either end of the long bone and then just compress it together. And this is the same way where a positive test would be considered pain, and you would also be looking to identify a possible fracture. Okay, now I'm going to demonstrate the vibration test, where you use a tuning fork, so that's called. And then on this one, you're gonna create a vibration from this, and then you're gonna put it not directly on the site and try to feel for vibration to look for pain. So let's say that the injury site in this case is on the bottom of the foot here, one of the bones of the feet. You'd hit it against your hand like this and then hold it like that and ask the patient to report pain. A positive test again would be pain, looking for a possible fracture as the pathology. And then finally, for the percussion test or the bump test, in this case, you don't want to hold in between the site that you're trying to put a vibration through. So I would hold up here if I was looking for a pathology in this part of the leg. You scoot forward a little bit, please. And then I would just bump the bottom of the foot like that. Again, looking for pain as a positive test to identify a possible fracture.
Okay, my name is Shay. I'm going to be demonstrating the Ottawa foot rules. So if a patient comes in complaining of pain in the foot, you would ask them to take as many steps as they could on that injured leg. If they can't take more than 4, that is an indication that they may have a fracture, and you would send them to get an x-ray to determine whether or not they have one. And then for the Ottawa ankle rules, you do something similar. They come in complaining of pain in their ankle, you ask them to walk. If
Ouch,
they can't
my
take,
ankle.
Yes, if they can't take more than 4 steps, or if there's pain 6 centimeters from the
Ouchie.
source of the pain, my goodness, then you would recommend an x-ray because that's also an indication of a fracture. And then I'm also going to demonstrate the anterior drawer test. I'm gonna take this chair. This is one that you test bilaterally. So you have them dangling their leg off of the table. You grab the back of their foot and you're going to pull the ankle forward. Don't rotate it, pull it forward, and you're checking for laxity. So if you pull it forward, Jordan doesn't like when I do this.
It does not feel good.
You're just pulling it straight forward. And if there is laxity, then the pathology could be damage to the ATF, which is the anterior talofibular ligament or the calcaneofibular ligament. And then my last one is the talar tilt test. This is another one that you test bilaterally. You grab around the shank and you rotate it inversion and eversion on both feet. And if they complain of pain on inversion,
Laxity.
yes, it takes for laxity. And then if there's laxity on the inversion portion of it, then that could be damage to the deltoid ligament. And then if it has laxity on the inversion, then it would be the calcaneofibular ligament.
Yeah! Hello, my name is Jared. Today I'll be taking you through a couple of the special tests of the foot and lower leg. And the first one I'm going to start with is the dorsiflex maneuver. So if you could please scoot back a little bit, my good sir. Perfect. So all I'm doing here is checking for a high ankle sprain. High ankle is right about here. And you simply do that by dorsiflexing the foot. And if there's pain in the syndesmosis right here, that is a positive test. No good. It means there's probably a high ankle sprain. And the next test I'm going to do is the Klieger test. So if you could come back, please. Yes, but feet dangling over. So this one, you hold the lower leg and then you put it in external rotation. So you don't want it to evert or invert. You want external rotation. And this one, you're checking for laxity in the calcaneofibular tendon. They tend to not like to stretch too much.
Oh, not the dad jokes.
Okay, and then if you could please scoot back once more. I like to make you scoot. So this is another way to check for a high ankle sprain, and it's quite simple. You just squeeze pretty close to or on the high ankle sprain itself, and you're checking for pain in the syndesmosis again, because high ankle sprain is right about in here. So if you squeeze and there's pain in there, then it's most likely a high ankle sprain. What's that test called? That test is called the Klieger test. I think I said that, but that's a weird one. Okay, and if you could please flip over. We're gonna do 2 more tests. And the first one, just relax. The first one, this one is the Thompson squeeze test. So you're checking to make sure the Achilles isn't ruptured. And you do that by simply squeezing the calf. And if the foot moves, it's not ruptured. Not ruptured. Look at that. Look at them move. And then the last one is called the Maddles test. So you put the feet up, and then you check both of them, make sure that they're about equal. And if they're dangling too much and they're not too much in dorsiflexion, you know that the Achilles is not ruptured because their feet are not tilting down.